Green Star team and the certification teams. Joining us today is Kelly Warden. Kelly is a project manager for health research, and she works with the USGBC, so the U.S. Green Building Council. Her work aims to propel action-oriented research on the intersection between the built environment and public health. So it's great to have Kelly here with us today. She also oversees the day-to-day activities related to the Green Health Partnership established between the University of Virginia School of Medicine and the USGBC with support from the Robert Wood Johnson Foundation. So thanks very much, Kelly, for joining us today. Now, before Kelly chats to us, just a couple of housekeeping points. You should be able to see your control panel there. You should choose the mic and speakers option. We don't have a telephone option today, so you should be watching the slides on your screen and listening to my lovely voice on your headphones there. Also, today's presentation is being recorded, so once we're finished here and we're able to process the little file, we'll make it available to members on the GBCA website. So don't feel like you have to take notes like crazy, because this will be made available to you. A couple of reminders on how to participate in the webinar if you haven't joined us before for one of these. That little box there has a questions section. Throughout the presentation today, if any questions arise, please just type your questions straight into the box. We are not going to answer your questions straight away, but there will be some time for questions, for answering questions in the end. So it would be helpful if, as you have questions, as questions pop into your head, you just type them right in. That way we'll have a number of questions to choose from in the end. We'll also try and answer all questions that come through later on, and we'll post the answers on our website. Okay. So we've been going through the Innovation Challenges series over the past few months. We have had I guess Innovation Challenges series is made up of those 3 innovation challenges that you see there: Reconciliation Action Plan, Integrating Healthy Environments, which is the one we're doing today, and Social Enterprise for Affordable Housing. As you know, Innovation Challenges are one of the criteria within the innovation category in Green Star. There are 10 points available overall. But I'll touch on that again in the end of the presentation. So you might have joined us for the Reconciliation Action Plan webinar that we had a couple of months ago. If you missed it, it's available on our website, so you should go and have a listen. It's really interesting work and really important work. So if you have any questions, let us know. So today, we're talking about integrating healthy environments, which is a great initiative. It's a cooperation between the USGBC, Enterprise Green Communities, and the GBCA and the Green Star team. So it's great to be working in collaboration with such great organizations. Social Enterprise for Affordable Housing. That will be the next one in this series. It's also a very important issue, so it deals with ways to try and solve the problem around homeless people in Australia. So it's obviously very important. We'll be talking about that in April. So, an innovation challenge is essentially an issue or a sustainability component that may be outside of the current scope of Green Star. Recently, we've been dealing with social sustainability issues through innovation challenges. When we say social sustainability, we mean any issue that interacts or intersects with people, be it health, be it social issues, be it well-being. So the integrating healthy environments innovation challenge is one of those. So the way in which they're structured, we try to very clearly outline an aim, and then we allow project teams, or we work with project teams to understand how they are looking to address that particular innovation challenge. Okay, so that was just my very brief introduction. We'll now have Kelly Warden talk to us about the work that she's been doing and the work we've been doing together.
Hi, thanks Robert for the introduction. Is everything working with my screen share?
Yep, all
okay.
Good.
Great. So as Robert said, my name's Kelly Warden. I'm here in Washington, D.C. at the U.S. Green Building Council, and I work primarily on a green health partnership that was formed between USGBC and the University of Virginia School of Medicine. We've recently been partnering with GRESB, which is an organization out of Amsterdam that works at the portfolio level as well. And the main focus of the Green Health Partnership is to leverage the market transformation principles of the green building movement for population health promotion. So looking at what can we learn from green building that we can apply for the promotion of places that really are intentional about the impacts that they have on people. So I actually have a background in public health. I have a master's in public health degree, and first I'll say that my other colleagues that are on my team are Matt Trowbridge, who's at the University of Virginia, and Chris Pike, who's at USGBC and GRESB, who some of you might be familiar with. But to first give you a little bit of background on what we mean when we talk about health and well-being, we're really focusing on a broad and holistic consideration of health, and so we rely on the World Health Organization definition of health as physical, mental, and social well-being, not merely the absence of disease. And so this is hoping to go beyond one individual pathway such as indoor air quality, although that's very important, but thinking more broadly about the impacts that built environment design and operation have on health. And so the scope when we talk about health in the built environment is really any individual or population that's influenced by the design, construction, and operation of built environment. So that's basically everyone. That's employees of companies that occupy offices, or customers that go into retail facilities, or the surrounding communities around those buildings, students in schools, hospitals, and also the supply chains that are impacted by the selection of materials and things like that. So starting, coming from the public health side of things, here in the US, and I get the sense that this is happening all over the world, there's growing interest in how to intentionally promote health through built environment practice, because from public health and healthcare, starting to realize that opportunities for health promotion are increasingly occurring outside of the healthcare system. And as you see on the screen here are some maps that are specific to cities in the US that are mapping life expectancy by metro line. Here in the Washington, D.C. area, or in New Orleans, there's not any public transportation, so it's actually just along highways. And you see that there's a great difference in life expectancy just depending upon what part of the city you live in. And part of this has to do with income and education status, but those are also things that are impacted by the built environment and structure of neighborhoods. So we recognize that there's features of the built environment such as stair design, accessibility of sidewalks and safe places for children to play, parks, supermarkets and healthy food outlets that really play a proven and critical role in determining health behaviors, which ultimately determine health status. And so this is what's really been driving interest from public health into how can we influence the design of the built environment to promote health and healthy behaviors. So this is a picture of the High Line in New York City, which some of you might have heard of before. It's a really popular project here, where basically it was a old raised railway that's been turned into a really interesting walk path that encourages physical activity and interaction with nature in a very busy and bustling part of Manhattan. And we're seeing increasingly instances of intentional health promotion through built environment design. And in some cases, developers are financially incentivized to create these places because consumer demand is high for walkable places. There's also been an increase in health-focused tools for use specifically by project teams that are working on building either interiors or whole buildings. And so one instance of that is the active design guidelines, which encourage physical activity through interior layouts and design. And so as a number of health-focused tools come online, we also recognize that there are existing strategies within green building rating systems that are related to health. And we did a scan a couple years ago of LEED 2009 looking at how health was currently referenced in the rating system and how many strategies were currently present that either intentionally addressed health or could be leveraged to intentionally address health. And what we found is that health is a long-standing value of the green building movement. At the very beginning of all of this, it's recognition that the environment really matters to health, right? But we've also found that there's not a very specific process to guide project teams through a systematic consideration of the health impacts of their work. And this leads to some of the random acts of health promotion, as my colleague Chris Pikes likes to refer to it, that we see within some particular really cutting-edge projects that have done a very great job promoting health because there was a certain grant funding or one specific health need at play that allowed them to be very intentional about the design of their building. So realizing that there are relevant strategies both within green building rating systems and outside of green building, and things like active design guidelines and other tools, it made us come to this point that but basically what project teams really need is a systematic process for addressing health and well-being. And so here in the U.S., this collaboration started a couple years ago between the U.S. Green Building Council, the UVA School of Medicine, Enterprise Community Partners, which operates the Enterprise Green Communities criteria, and also the Health Impact Project, which is a group of public health professionals, to lead the development of this new criteria that really creates a process that is trying not to be one new, very specific, targeted strategy to address one niche aspect of health, but rather be an overarching process that could be applied in a couple different contexts. And so we're very happy for the opportunity to partner with GBC Australia and launch this strategy for the use within the Green Star rating system as well. So when we were creating these new strategies, we were really inspired by both integrative process and health impact assessment. And being green building practitioners, you're likely aware that the integrative process and integrative design are utilized by green building professionals to identify synergies and interrelationships between systems. And currently, this process focuses primarily on energy and water. Our hope is that health outcomes can be considered alongside energy and water when the project team gathers at the beginning of the project to identify those interrelationships and potential synergies. We were also inspired by health impact assessment, or HIA. And health impact assessment is a well-established process for making decisions through a health lens. And it uses an array of data sources and analytical methods, and it considers input from a number of different stakeholders to determine the potential effects of a proposed policy, plan, or program on the health of a population. And it basically just creates a health lens over any sort of decision-making process. So health impact assessment as a whole is a very broad framework that could be applied at a number of different scales. And we're careful to specify that the process that we've described within the LEED rating system and also the Enterprise Green Criteria and now Green Star, it does not represent a full health impact assessment, but it draws upon principles of HIA to really guide project teams through a systematic consideration of health. And so primarily these strategies are focused on first starting with an understanding of who your population is and what their specific health needs might be. So really encouraging project teams to think critically about how their work might affect the health needs of a population, and also hoping to identify any potential vulnerable populations at the beginning of the project to make sure that there aren't unintended negative consequences for health. And the second aspect of these strategies is to prioritize strategies. So again, recognizing that within Green Star, within LEED, within Enterprise, all of these green building tools, there are a number of different strategies that project teams can choose from that have different impacts on health. So after beginning with an understanding of the population that you're working with and its specific needs, how can the project team think critically about prioritization of strategies at hand to intentionally promote health through the design of their project? And so I'll let Robert provide the specific details for how this will roll out within Green Star. But one thing I will say, we really do appreciate the ability to partner with GBC Australia in this, in part because I love the way that the innovation challenges within Green Star are very flexible and allow project teams to start with a very broad scope, a little bit more broadly than the pilot credits here in the US. But I will encourage you, as you're thinking about how to impact health through your project, to not get too tied up within the very traditional, more healthcare focused health outcomes. So taking the logic model approach, which is a commonly used approach within public health that recognizes that there is a lot of steps in between one specific action and the ultimate health outcome. So the logic model example that you see on your screen here has to do with community center financing, but you can see that on the inputs, these are basically the resources that you have available to you, and then the activities are what you actually do with those resources. So that would be actually building a building, and outputs would be the result of your activities. So if you intentionally chose to put a stairwell in front of the building rather than have the elevator be the first option when people walk into the building. And then the outcomes are divided up into shorter term, medium term, and longer term. So start to think about what different types of things project teams could measure throughout the timeline of a project to depict the changes in determinants of health that will ultimately roll up to changes in health outcomes. And within this, we're really encouraging project teams to think about the social determinants of health frame, which focuses on things such as access to physical activity, access to healthy foods, access to opportunities for social cohesion. And these sorts of determinants might provide better opportunities for measuring change within a time frame that makes sense for the project team, because we know that changes in ultimate health outcomes like obesity or cardiovascular disease, things like this will take a lot longer to actually occur. And so we're not expecting project teams to deliver on any sort of robust changes in ultimate health outcomes, but rather focusing on those more proximal health determinants. So that's all for my overview in terms of introduction about where we are, how we got here on the U.S. side, and so I'll turn it back over to Robert to talk specifics about the Green Star Innovation Challenge, and then open to any questions after that.
Excellent. Thanks very much, Kelly. That was great. Thanks very much for taking the time to introduce everyone on this side of the planet to that. So what I thought I could do before we talk about some questions and some of the initial feedback we've had on this innovation challenge was to briefly describe how a project team is able to apply this great innovation challenge to their Green Star project. So in simple terms, you'd go to the GBCA website, and when you hover over the Green Star little tab there, you can see that innovation in Green Star is one of the alternatives that shows up. Integrating healthy environments is one of those innovation challenges that you're able to choose. Now, as you can see there, at the moment, there are no restrictions to how you apply that integrating healthy environments innovation challenge. A project team may choose to do it or try to approach it at a planning and community level with Green Star communities. They may try and do it through the design of an entire building with Green Star Design and As-Built, or through Green Star Interiors, which focuses on the design and construction of a fit-out, obviously, but also within Green Star Performance, which is a Green Star rating tool for buildings in operation. So there are a lot of opportunities here for project teams to apply this initiative to their projects and deliver health and well-being to the occupants of those spaces and communities. Now, when you go to the website and you download the Innovation Challenge, it will be structured slightly different from a credit that you may know, but you'll also have some similarities to a credit within Green Star. So there is a clear aim outlined. So the idea is that this innovation challenge will support high-performance, cost-effective, and health-promoting project outcomes through an early analysis of the interrelationships among systems. And that's, this is the really important part of the thinking that the project team would have to lead, they'd have to participate in, that the interrelationships among the systems would deliver a high-quality well-being outcome. Now, the other thing that is included in this innovation challenge are some suggested compliance requirements and some suggested documentation requirements. So if a project team wants to apply it to their project, and this will very closely align with the with those two priorities that Kelly just presented. So the first requirement would be for a project team to conduct an analysis of community health needs and outline the distribution of health issues among impacted communities. So essentially looking for public health data and information for the user group that will occupy the project or space. Then working at prioritizing strategies to address identified needs. So if there are a few health issues that might be identified through the initial analysis, the project team would then identify actions that could be taken to enhance health supportive features of the project itself. Then we have a couple of other suggested compliance requirements there that the project would have to demonstrate how they intentionally implement selected strategies to address those issues. And finally, and that's the final dot point is quite important because it contributes to the overall knowledge pool in the subject, would be to develop a monitoring plan with performance metrics to evaluate the project's impact. This is really where the rich data-driven design would come from. Obviously, we can work with project teams on alternative compliance methods We encourage project teams to contact the GBCA and put forward how they want to address this particular innovation challenge. As far as, oh, and I should point out, this is a free of charge service, so don't be discouraged to contact us. There's no cost for a project team to approach the GBCA and put in a credit interpretation request, or a CIR. Within documentation requirements, we talk about a few things. We talk about submission templates. So it's just a standardized way of project teams to put forward their ideas, and I'll look at that in a second. And then we have 3 suggested supporting documents, or 3 suggested types of supporting documentation. So, something we're calling a community analysis report. So this is a report or a collection of reports that outline how the analysis was done and how the prioritization took place. We then ask for the monitoring plan, how the organization that's going to occupy the space or community intends to monitor and keep track of these metrics, and any other supporting documentation. So, as suggested earlier, as this is an innovation challenge, these are suggested compliance requirements and documentation requirements, and we encourage project teams to contact us, chat to us about the ideas that they might have, talk to us about any other approaches that they might want to take to deliver on health and well-being outcomes for the project occupants. Now, the other thing that we make available are submission templates. So you're able to download a submission template from our website, and it's going to look something like this. Within that, there'll also be a question or two about any project-specific queries that you might have, and for innovation challenges, that's typically going to be the case. We then have a very simplified way for project teams to outline where the documentation information can be found. So, for example, one of the things that we suggest is the project teams provide the results of the community health need analysis. So in this fictitious example, the project team is working on a retirement village, and they outline how throughout 1 year they conducted surveys and they tapped into public health information that's available out there. So this is just an example. It's just to outline how someone would go about documenting their submission for this particular innovation challenge. And then there's a bit more room there for project teams to add a discussion. So this is where you would outline any difficulties in documenting the innovation challenge, anything you might want to tell the assessment panel that's going to look at the Green Star submission so they can understand the approach the project team has taken. And then finally, there's a short declaration component there in which the member of the project team that's responsible for the innovation challenge says, yep, I've done it, and I confirm that this information is accurate. And if you have any questions, get in touch with me. So, are there any questions? We asked participants to type in their questions in the beginning of this conversation. I haven't had that many questions. Okay, Claire's just helping me here, pointing me to a question. Okay, so one of the questions that comes through from Nigel, he asks, with public hospital design in Australia, whilst capital and operational costs, energy efficiency, etc., are appreciated, the importance of a Green Star rating or similar is downplayed because the building won't be sold. There is no financial market for it. How do we get over this mentally so that public buildings aspire beyond minimum standards? That's a very good question, Nigel. And I guess the whole conversation today has been, about that exactly. It's been about how, green buildings, or the concept of green buildings, goes way beyond energy efficiency, right? The idea here is that the interventions that project teams put into place will have a direct impact on the health and well-being of occupants, and in your example, the health and well-being of patients. I wonder if Kelly has an opinion or some suggestions for Nigel.
Yeah, absolutely. It's a great point. I know that here in the US, it's been difficult. The healthcare industry in particular has been difficult to bring along on the green building movement for a number of reasons. I think that I'm not quite sure what the climate is like in Australia in terms of public hospitals and their responsibility for the health of the surrounding community and so forth, but something that's been shifting here in the US is this recognition and encouragement for public hospitals to really be on the line for the health of the community surrounding them and really sort of be on the line for value-based care. And I think that as you build out this value proposition of what green building has to offer, particularly when you're taking an integrative approach that considers all these things, energy, water, and health outcomes alongside each other, it would hopefully sweeten the deal a little bit, even though the hospital doesn't benefit from the resale value of that building due to the Green Star rating, but perhaps it's a way to speak to the hospital's values in terms of excellence, and which would then speak to their performance as a hospital. I'm not sure if that's helpful.
Yeah, definitely. I mean, those conversations are definitely taking place in some areas of public health. At the moment, one of the largest hospital projects in Australia is going through Green Star certification. There were conversations at the time with the state government in charge of that project and the design team and the construction team. So it was, I guess, there were multiple incentives at the time for that Green Star certification to be pursued by this particular hospital project. One of the conversations was, how can we make sure that the recovery rates for patients can be quicker? So there was a little bit of an overlap with health-related imperatives as well as a financial one. So thinking about, if a patient stays or recovers more quickly, the hospital can serve more patients. So there's a little bit of a conversation around that. But yeah, the focus should definitely be on health and well-being in a hospital sense. Sorry, there's another question coming through from Gary. And he asks, in your knowledge, when seeking green building certifications, do the health and environmental criteria generally align, or are there examples of where there's conflict? And if so, where might this be the case? Interesting. I'm not aware of any conflict. Do you have any examples in mind, Gary? If you do, just type it into your question box and we can read it. I'm not aware of any conflict. There's definitely a bit of, I guess it's what I call the balancing act of sustainability. Some project teams that may be very focused on energy cost or energy efficiency or reduction in carbon emissions, they may sometimes think that in order to deliver a very energy efficient building, that they might have to sacrifice on indoor air quality. That's definitely not what the numbers point to as far as Green Star certified projects. When we look at Green Star certified projects, in particular the world leadership type ratings, project teams are definitely concentrating on both greenhouse gas emission reductions and increased indoor air quality outcomes. So maybe that's where there's a little bit of a perceived conflict there. Any thoughts on that, Kelly?
Yeah, I'll just build on that and say, I know I've heard this perception before that perhaps as we focus primarily on improved outcomes for the occupant, then we're going to sacrifice something on the environmental side in terms of energy and water use. And yeah, I would just second your comments, Robert. I'll say it's one thing that's been really interesting to parse through is the different levels of impact on health that's present within green building, because you have, at the global scale, any sorts of efforts to reduce energy use and reduce emissions is going to have a positive impact on the health at the society scale, right? Health for the future generations. But then there's these trade-offs that can occur in terms of, focusing on strategies that specifically benefit the occupant or specifically benefit the surrounding community. And I think that those strategies are ones that are a little bit more difficult to identify as they're currently presented within common green building tools. But yeah. I certainly don't believe there's any sort of trade-off that's happening in between environmental and health outcomes, but rather they are very much in synergy with each other.
Definitely. Gary just typed in a couple of other words. He's saying, for example, selection of materials. Mm-hmm. Yeah, Gary, the selection of materials in green buildings is very, I guess, tightly looked at. It's one of the focuses of the materials category in Green Star, that the materials used in buildings are health promoting. For example, the VOC emissions from materials used in buildings are definitely one of the concerns in green building schemes. But yeah, so there should not be such a conflict. I'm happy to talk to you later on as well, Gary, about this in particular. I just wanted to address a couple of other really interesting questions that are coming through. So Thorsten asks, can you talk a little bit more about the monitoring plan? My concern is that health data will not be readily available due to confidentiality. Interesting. So the idea of the monitoring plan is that the project occupant, so whoever takes charge of the building or fit out, is able to continue on this health journey and investigate if the intervention put forward by the project team will indeed have the intended result. So there's no intention that this monitoring plan is submitted or delivered to the Green Building Council in any sort of raw way. It would be definitely encouraged that the results of such an intervention be shared in some anonymized fashion. But there's no intention that confidential information is put forward. Kelly, any other ideas?
Yeah, I'll say to build on that and sort of going off of the logic model approach I discussed at the end of my previous comments, one thing that we've done within both the enterprise criterion and the lead pilot credit here in the US is created a table to guide project teams through consideration of this monitoring and evaluation plan that includes sections for design metrics and operation metrics, and then ultimately health metrics. But first focusing on things, a design metric would be, if you find that your population struggles with asthma or respiratory issues, then within the design of the interior, perhaps you're specifying that there's not any carpet, or there's anti-asthmatic flooring materials are selected. And then within the operations, perhaps you have a metric that's about screening indoor air for the presence of asthmagens. And then at the long sort of final cap would be the health metric component. But we're really trying to encourage project teams to not get too focused on that specific health metric, particularly in the individual at the individual level, for exactly that reason. We're not interested at all in getting into any privacy concerns. So really thinking a little bit out of the box about how can you use your expertise from the project team side to think about innovative ways of monitoring the impact that the space is having on the people that are occupying it without necessarily jumping immediately to that individual level health outcome.
Great, thank you, Kelly. Yeah, there are a couple of other questions here. So Andrew asks, within Green Star communities, there are credits that target integrating healthy environments in some way, and he gives some examples. There's a credit that deals with healthy and active living, walkable access to amenities, access to fresh food, etc. So Andrew sees some overlap between the existing credits and this innovation challenge. It seems that the major difference between the innovation credit and the existing credits in Green Star communities is the analysis of community health needs and the monitoring plan. Is there scope within the innovation credit to address aspects not currently addressed in the Green Star communities tool as well? Thanks, Andrew. That's a very specific question, but a good one. So it's my understanding that the innovation challenge, as it stands, one of the benefits that we're trying to inform project teams and the outcomes that the project teams put forward is the way the interrelationships between systems plays out. So all of the credits that you mentioned from Green Star communities in particular, there should be an interrelationship between all of them. Now, you're right in saying that the analysis, the need analysis, or the access to public health data is one of the focuses of the innovation challenge. But I believe the crux of it is to suggest that project teams should think about the health outcome and all the other initiatives that are within a project in a more holistic fashion, so that there's that integration in thinking. Is that right, Kelly? Is that the idea?
Yes, yeah, absolutely. And we're really viewing this innovation challenge as a way of highlighting those relevant strategies that are already in the rating system, whether it be the community's rating system or otherwise. So highlighting things such as a strategy that increases access to healthy foods or promotes physical activity, and encouraging project teams to prioritize such strategies if they find the need for them within the population that they're working. So this innovation challenge would be very related to certain strategies that currently exist within the Green Star family of rating systems. But yeah, adding on that process layer that's missing currently, and just thinking exactly more holistically about how do all these specific strategies play together to impact health in a really robust manner.
Excellent. Just a couple more questions. We still have some more time. There are a couple of questions here about the checklist that you mentioned, Kelly. Can you describe that a little bit further?
So the table for sort of
for the monitoring plan, I guess.
Monitoring
yeah.
that. Yes, yeah. So what we've done, and actually, I could share my screen and show you the table from the enterprise criterion if that would be helpful.
Sure. Let's just work on the technology here. But and I guess another question that was asked relating to that checklist was, is that something that's shareable?
Yes, yeah, absolutely. So this table that I'm showing you now is part of the Enterprise 2015 criteria that were released last year. So it's publicly available online, and I'm happy to send it to you, Robert, and you can disseminate it throughout your stakeholders. But
Great.
basically it's guiding the project team through, you have here it's an example of asthma, so it's the one that I was referring to previously. So the population need is that you have, and I should remind you that this particular table was set up for use within affordable housing. So it hits the childhood aspect of it. So say you find that there's a high incidence of childhood asthma, and then the project team has gone through the different strategies available to them and selected to, in order to target this problem of asthma, they've decided to eliminate or reduce the use of potential asthmagens. And that specifically the strategy that they're taking in order to reduce the presence of asthmagens is to specify linoleum for kitchens or cork for floorings or so forth. And so then when you get to the metric side of things, it's guiding project teams through a consideration of the potential performance metrics that they could choose, both at the design phase, at the operations phase, and at the ultimate health metrics phase. So whether that be carpet, flooring, different sorts of material selections, or maybe even HVAC ideas, and then operations being actually how is that space operating? Are the strategies that you implemented within the design and construction phase, are they fulfilling their intended outcome in terms of changing the environment for the better from a health perspective? And then suggesting a potential health metric. And in the US, we've been framing this health metric piece as something that the project team would not be responsible for monitoring, but rather if you are able to partner with a public health professional throughout your project team, throughout the project design, then maybe that's on the public health professional to follow up, or if it's the occupier of the building, maybe it's the HR manager that's responsible for actually tracking the ultimate health outcomes, because recognizing that the project team is probably going to sign off and leave the project before these changes in health outcomes occur.
Excellent. Thank you, Kelly. One of the other questions that have been asked relate to, I guess, project teams and design teams and consultants in general tapping into the knowledge base that's not typically part of a project. So health professionals or those people involved in delivering those impact assessments. You and I chatted about that a little bit, Kelly, prior to the webinar. Can you talk about that a little bit, what the experience has been in the US and how project teams may tap into a different knowledge base?
Yes, yeah, absolutely. So as I mentioned, here in the US, there's a growing body of public health practitioners who are really interested in the impact that the built environment has on health. But we are recognizing that public health, if it's a master's degree or whatever other sort of training, doesn't necessarily equip someone to jump in a really robust manner with a project team and add value within the design process. So we've been working with partners here in the US to come up with different sorts of trainings to use both on the green building side, but then also on the public health side to bring a public health professional up to speed on how a built environment project comes to be, who are the different members on that design team or project team that are consulting together to create the design and then ultimately execute the construction of a space, and what are the different opportunities for health intervention. And so we are in the mix of creating such guidance documents, and we'll be happy to share them once they exist, which won't be anytime immediately soon. But what we've also recognized here in the U.S. is that since health impact assessment is such a well-defined field, there is a network of practitioners who specialize in health impact assessment. And again, just because you specialize in health impact assessment doesn't mean that you'll be able to immediately jump on board with a project team. But HIA is very unique in the sense that it's meant to be used within a variety of settings and contexts, and it's really supposed to be just an overarching process that could be applied at a number of different scales. And so what we're hoping to do in the U.S. is connect the network that USGBC has of green building professionals with the network that some of our public health partners have of public health and health impact assessment professionals, and try and start to catalyze those local connections. And I get the sense that health impact assessment is an established field within Australia as well. And I think I was talking with Robert about some ideas for GBCA's ability to link up with some of these more national public health organizations that might have networks of those public health professionals that, while they might not be equipped at the moment to jump in with you on a project like this, perhaps with some additional guidance or training, they'd be able to really add value to the project team.
Excellent, thanks, Kelly. Yeah, definitely. We're hoping to tap into those, I guess, non-traditional built environment networks over the next few months. So it'll be great to continue to work together with you guys on that. Now we have a few more questions which we're not going to be able to get to right now. So we intend to answer them through our website. So we'll publish a little document with the questions and answers. So thanks very much, everyone, for putting your questions forward. Now, I have a couple of other things to say before we call it a day. So the Innovation Challenges series that we've been working through, there's a third in the series. So we're looking at social enterprise for affordable housing, and that's scheduled for the 29th of April. So hopefully we'll have some of you coming back to hear about the work that we are doing with the guys from the Big Issue. And lastly, we are holding our national conference in collaboration with the Property Council from the 22nd to the 24th of March here in Sydney. And I hope to see most of you there. Yeah, so that brings us to the end of our webinar for today. Thanks very much, everyone, for contributing with questions, for remaining interested. And again, if you're working through a project, in particular, those projects that are earlier on in the design process, as well as those buildings in operation that you may be planning some interventions to, please reach out to the Green Building Council. Please reach out to your technical coordinator if you're a registered project already, and we'll help you through the process. Thanks very much, everyone, and stay in touch. Thank you, Kelly, so much for dialing in from DC, and hopefully we'll stay in touch with you as well, and we'll continue to exchange ideas.
Yes, thank you so much for having me, and yeah, I look forward to future collaboration.
Great, thanks.